Good morning again, everyone, and good afternoon to some of you who are on the East Coast. I'm currently on the West Coast. My name is Jessica Hua. I'm an account manager from Exxat. We wanted to thank you for joining us today for part 4 of 15 for sites and locations topic, which is part of our Exxat Prism training series for our webinars.
Thank you so much, Jessica, for the quick introduction. Good afternoon and good morning to the folks who have joined this webinar. I'll be walking you through the detailed on-sites and location training. So let's start with sites graph. So what is sites? A place where the business takes place, okay, where we build our contracts, where we have our initial discussion with the sites to identify the personnel who is going to train the student or during their clinical experiences, right? What is location? Where the patient care takes place. But we can map or add the personnel on the site level, but we can also associate the same personnel on the location level as well. Even we can add, right? Now let's see the difference between site and location. So site is basically the overarching entity where the business takes place, right? Where we have our contracts negotiation, where we have our administrations, but we don't have a finalized placement for the students. But we can also capture documents like requirements, any documents which needs to be uploaded by the students, any contract specific documents, any practice specialities which is being offered by that particular organization, right? Corporation. Now, what is location? Where the patient takes place and where the students will have a finalized placements, and we will see the documents which are being inherited from sites, like the documents which needs to be uploaded by the students. So let's see an example like how it is recommended or the approaches to have the add data added into the system. So for nursing and PA, sites are basically the hospitals, but the locations are unit. For example, NYU Longon Medical Center is basically the hospital, but for nursing and PA, the unit is basically the emergency department or the med surge. For PT and OT, sites are basically the health system and the locations are hospitals. So example like NYU Health and Hospitals of Joint Disease is basically the hospital. Moving on to the next, which is site sharing model. So we have 4 options for site sharing model. So let's go one by one. The first option will allow you to share the basic information and just the contract, but the patient care location is not at all shared, or the personal information or personal detail. And this is mostly adopted by PT, OT, PA, and nursing schools. But we also offer a couple of uh, sharing models like partial sharing, where you would like to share the basic information, contracts related information, and where the patient care takes place, but not the personals. And the personals will be individually added by the institute or the program itself. For example, PT and OT mostly use this feature so that they can add their own CIs or fieldwork educators. But we also offer option 3, which is all sharing. Everything is shared across all the institute programs. So you can share sites, you can share contracts, you can even share patient care locations and the personnel which is added on the various campuses. For example, if your institute has for an individual program multiple campuses, this model will suit more. And the fourth option is no sharing, where the within an institute, if you have more than one program and if every program wishes to manage their own data, then no sharing model will come in handy. So you can have this discussion with the account manager when we are setting up the account, right? So that you can identify what you would like to share with the programs or on the institutional level. Based on that, the sharing will work. Going to the next step, which is site navigation. So when you log in into your Exxat account, you will see under placement management on the right side third card, the first option is sites. And also on the left hand side, you will have a tiny 3 dashes. When you click on it, you will also see the same option available in the list. And when you click on that, you will see The landing page will be location on the horizontal bar, but let's start with setup. So when you click on the setup, the first option you see it under is announcements. If you wish to set an announcement to, show it on the sites page, you will click on add announcement to set up like a graduation preparation event, or if you have updated a clinician specific manual, or there was a changes in syllabus, right? So when you click on add announcement, a drawer will show up where you can set the start date, end date, and the title of the announcement, description, and you can pick and choose whether you would like to show this information on site resources page. And if you click on save, the announcement will go live. For example, this is how it will look. Okay, where we have updated weekly food drive as an example. Moving on to the next, which is resources. If you wish to share resources with your clinicians or clinical site partners, and you can create custom categories. For example, student specific resources or clinician specific resources, any syllabus documents which you would like to share it with your clinical site partners, or any general document like a magazine or something like that. If you would like to create your own custom categories, you have to just click on the pencil icon so that you can type out the category name. For example, in this case, it's the student resources. So when you click on student resources, a drawer will show up where you can select the type of resource, where you can select the category. You can enter the title of the resource, description, and if you're sharing a link with them, you can paste the URL. So you can share a document, you can share a video, you can share a frequently asked question as well. So once the resources is added, on the site resources page, you will have a dedicated tab where it says program wide resources, where the clinicians or the clinical site partners will be able to see the category on the left hand side, and when they select it on the right hand side, you'll be able to see the documents, videos, links, or the frequently asked questions which have been set. So you can also uncheck those checkboxes so that you can focus on a particular category as well. Moving on to the site organization. So site organization allows schools to categorize or group their sites in different categories. For example, let me give you a couple of scenarios. If you wish to group your sites as private practice, or if you have a site which is a standalone clinic, right? You can mark it as standalone clinic. If you have rural health clinic hospitals, or tribal health developments, or tribal organizations, or veteran affair healthcares. So you can add them under site location categories. So what is the added advantage of creating those categories? In future, if you'd like to know that, okay, how many sites do I hold for standalone clinics? In order to slice and dice the sites which you're holding right now, that custom category will come in handy for you. So if I select option which says payment or no payment. For example, if you have sites at the rural areas and the students are willing to go on rural areas, right? And if the sites are providing stipend to the student, then you can mark those sites as payment or no payment, because sometimes this payment might be helpful for the students to also visit the rural areas. So if you mark all your sites as payment, and if you would like to know how many sites you are holding, which allows students to have a stipend if they go on those locations. So in order to filter that, these categories will come in handy for you. Likewise, you can create categories for personal as well. For example, if the personal is also open to other programs, you can create a category. If the personal is required to, have to be contacted before placement, you can create a category calling it as personal contact. If onboarding is needed, then you can create a category for that personal as onboarding, right? If we need to build an affiliation or a contract with that personal as well, you can call it as contract contact, right? So those categories will allow you to tag on a personal so that you can apply a filter and see, okay, how many, if the site has a preceptor which requires placement needs to be contacted before the student is sent to the clinicals. Next is contract organization, and also you have location area. Before we move to the contract organization, if you wish to group your locations by a particular region like north coast, west coast, east coast, or a particular state like tri-states or something like that, you can also create those categories. So if you wish to see how many sites are you holding on north coast or how many sites are you holding on west coast during that particular filtration, this category might come in handy. And the by default categories you will see is in area, and out of state area. In order to add them, you have to just click on this pencil icon. A drawer will show up and you can add those categories. And you can remember that the setting will be added at the program level. So site contract organization. So you can also create your own custom categories for categories for contracts. For example, assume a scenario if you have contracts which are open-ended and which needs to be reviewed every 3 years or 5 years, right? You can create a category calling it as open-ended review 3 year, open-ended review 5 year, so that you can tag your open-ended contracts at a regular interval. You have to just select that category as a filter, and you will see all the sites which are marked with that particular category. But the routing checklist is something which is set by the institutional level. You may not be able to edit them if it is being not editable. If you don't see a pencil icon, you might need to reach out to your institutional administrator to make those changes. Okay, so the routing checklist by default, you will see date signed by dean or date signed to provisit or copy sent to the department. Okay, next is, so when you wish to add, a drawer will show up on the pencil icon. You can add that field and click on add category and then save it. Next is site sharing model. So as we discussed initially, those options like what is being shared across programs or on the institutional level, you will also observe a tab which says site sharing model. If you'd like to know what type of site sharing model we have been into, when you click on site sharing model, you will be able to see the description on the right hand side. Currently in my example, this is Exxat Prism model, which allows you to share everything. But in order to understand in detail, like what is being shared across program versus what is being not shared. So when you scroll down a little bit, you will see a grid with the list of entities which is being shared across program, which is not being shared across program. For example, if I take the first row, sites, right? The basic information is being shared, the address information is being shared, the contact information like phone, fax, and website, and the program list. But what is not being shared is the requirements, tags, nodes, communication settings which are being offered by that site, and slots. Okay, likewise for contracts and location, you will see them in green, and those which are not being shared, you will see them in red. But if you closely observe, the personal is not being shared across the program. The personal needs to be added by the individual program by themselves, because there might be a chance that the student has a new personal, and that's why it is recommended to add manually. Okay. Next is, let's see how do we add a site into the system. So once we set up the basic information, like what are the categories I'll require, any announcements which I need to set up, what is the site sharing model. Once we understand the setup, we will go to the sites to add our corporations or overarching entities on this section. So in order to add the site, on the right hand side, you will have a button which says add site. And when you click on that button, a drawer will show up with the details like basic information, address information, and contact information. And if you see any field with a black or a red color asterisk, needs to be considered as a mandatory field. In this example, if you can see, the name, address line 1, city, and state are the only mandatory fields which is required to add a site or the overarching entity into the system. So once it is added, it will start showing up. Next is locations. All the locations which are being mapped with the overarching entity. So for example, if you see the column location, you will see all the list of locations which are added into the system. And in order to see the association or the overarching entity, if you closely observe the last column, which will show you the corporation or the overarching entity name. For example, under abundant health, you can see I have 4 locations which are on 4 different addresses: city, state, and zip codes. Okay, moving on to the next. So also you can extract the location specific information when you click on this tiny two dots. In order to extract, you can edit the column. If you wish to have a desired report, you can change the column sequence by clicking on the six dots and dragging it to the top or bottom, changing the sequence. Also, you can use this arrows to move the position of the column. Once you have moved it, you have to just click on this page icon to extract that location specific information as a report. But this tiny filter icon will allow you to slice and dice the information. Let's go back to our initial setup page. If you remember, we have also created personal category, right? So you can see under filter option, you have personal category as well. So when you click on personal category, you will see the list of options, custom options, which you have created. For example, placement require or open to other programs or contract contact, right? Those categories will show up there and you can select them so that the information will get sliced and you will have the report on your end in the grid view. And in order to download, just click on this page icon. So next is personnel. So all the personnel who have been added within the system with their designations, site, all the locations where they have been mapped, city, state, is it an active personnel or is it which program this personnel has been mapped, all those information will show up on the personnel tab. And again, you can extract this information by clicking on those range, filter, and the page icon. So contracts. If you wish to extract the contracts within the system, you will see all the sites with contracts on the first tab and all the sites with missing contracts in the second tab within the contract section. And if you wish to extract reports, you will be using those three icons which shows up on the right hand side. But what is the added advantage? If you would like to know the list of contracts which are expiring in 30 days, 60 days, 90 days, or a particular duration, sometimes you might wish to also see like, okay, my clinical rotation summer is starting from May 13th or May 15th, and it's going to end around June 30th or something like that. And if you would like to know the site in which I would like to place the student, do we have a valid contract or not? Because we want to ensure that the contract is not expiring when the student is in the clinicals, right? So you can also select the custom range to ensure the sites which you are going to use has no expired contracts. So you will be using the filter icon to apply that information. Next is emails. In order to establish or set up a communication with your clinical site partners, requesting the availability from them, we will be using the emails. And we will see this in detail a few minutes down the line. Okay, and we will set up some communications and see how your clinical site partners will see those communications, how they provide you the availability. Next is explore location. Assume a scenario you have entered all your locations within the system and you wish to see all those locations on a map view. So explore locations help you to see all the information on a map. So in order to see a desired location, you can apply filters on several options like state, city, zip code, or the name itself, or you can use location area. If you're creating a custom categories, for example, you can see North Coast is an example on my screen. So you can select that particular option and click on show results. The system will start showing up pins, a red color pin of all the locations which fall under North Coast. You can also apply filter on settings. If you're mapping all your clinical settings with the required locations, or if the location is offering a particular setting, and if you would like to see for a particular setting, do we have a location? You can, if you wish to see that on map, you can apply on setting, as well as if you create a custom tag, you can also apply a filter on custom tag. But the interesting part here is, if you wish to know what is what are the list of locations which are falling under a particular miles of radius. So assume a scenario that if you want to know how many locations do we have within 10 miles of radius, right? Sometimes student might come to you and ask you, I need a location which falls under 5 miles of radius or 15 miles of radius, right? In order to do a quick check, you can come to the explore location and use this draw miles of radius filter, select from school and enter the number in miles. For example, I need to know the list of locations which falls under 25 miles. And when I click on apply, a circular area will form and you will see all the dots and numbers which will be falling under that particular miles of radius. And if you wish to reset everything, you have to just click on this reset all button. Okay, clicking on next. Reports. So we will be going in detail for each and every report we have for sites, personals, and locations. So taking a question break to check if we have any questions till now. Jessica or Ami, can you please cross check in the chat if we have any so that I can answer?
We don't have any at this time.
Okay,
Just for those who joined a bit late, please put your questions in the question box.
sure. So let's move ahead and then see site profile. So when you add a site within the system, and if you click on the site name, the first horizontal tab which you will see and the landing page will be, for example, in my case, the ability center tab will be about, and you will be able to add or edit the information by clicking on this pencil icon or the plus icon. So when you click on the pencil icon, a drawer will show up. For example, if this site is applicable to more than one program, and if you would like to associate, just click on this pencil icon and select the program. In this example, you can see this particular abundant health is mapped with PA, PT, social work, nursing, counseling, and speech pathology, right? And if you say if your model is not set to no data sharing, then when you click on this pencil icon, all the programs which are listed will be grayed out. You will not be able to select them, but you would like to check with your institutional admin to check why we have a sharing model, or what is the purpose of not having a sharing model, because there might be a chance you might have a dedicated team which operates differently, capturing the availability of sites or slots in a different way. We can also capture the site specific requirements. For example, for this particular site, I have a requirement of COVID vaccine, but it is not a must have because we might have already collected the document in the compliance section. But there might be a couple of cases like where the site will say, I need to capture a couple of site specific documents which a student needs to share. In order to admin cross check, you can capture those documents under site requirement to be uploaded. For example, onboarding form, right? Any site guidelines or any document which they need to sign off before they go, like a site checklist, right? Whether they have read through all the policies or information before they visit that site. So we can capture those documents under site requirement to be uploaded. We can also map the settings which are being offered at this site. For example, this site is offering me a med search or a family medicine or a mental health. And if you map those settings, you will be able to map them here. And also when you are on a site, on the right hand side corner, you will see a delete site button. If there is a data dependency, the system will not allow you to delete. And in order to edit, when you click on the pencil icon, the drawer will show up. You will be able to see all the settings which are added within the system on the program details level. All you have to do is just click on those bubbles which you would like to map, because these are the settings which are being offered at that corporation or the overarching entity level. Next is contracts. So once we have added the contracts, and if you wish to see the information, you will be going under about. Okay, and if you would like to generate a contract, you will be clicking on the contract generation tab. But there might be a chance when you click on contract generation right now, the page might be blank. In order to have your template configured in the system, I would recommend you to generate a support ticket so that the support agent can coordinate with you and create the document for you here. For example, you can see Exxat University is one of the document, or COVID amendment is one of the document, right? So once you have those documents configured, you have to select those documents and click on generate. So the contract information which you have housed within the system will be extracted in the format which you would like to have it as per that document. Okay. And also you can link a contract with an existing site or a contract. For example, when I click on this chain icon, the tiny chain icon, a drawer will show up where you can see the contract name, the contract number, the sites which you would like to map, and the grade ones are the ones for which this particular contract is already mapped or applicable. And you can also see for which program this contract is also applicable. For example, in this case, you can see PT, DPT, and speech pathology as an example. When you select this particular site to link, you can just click on save so that this information starts showing up there as well. And you will see a tiny chain icon, something like this on that particular contract. Next is locations. In order to add a location, you will be clicking on add location, and also you will be able to see all the locations which have been housed for that particular corporation. If you closely observe, the abundant health is my overarching entity, and also you can see multiple locations and addresses for that particular overarching entity. In order to add, we will click on add location. A drawer will show up where we can enter the basic information, label, location area, all the mandatory fields such as address, line 1, city, state, and we can also capture the contact information. Well, and also we can have the additional information such as rural location or under reserved population, or show it on clinical location. So if you feel couple of locations which are inactive and you don't want them to show up on locations, you can also mark them as no. Okay, and also if you feel that these are locations which are only used by level 1 or level 2 students, or if you don't want to show up them on map, you can also mark them as no. Moving on to the next, once the location is added and if you click on the location name, now you will be able to see the location specific information. In order to edit the existing location information, you will be clicking on the pencil icon. The drawer will show up, which we just added, the same drawer, and you can edit. For example, if you feel the location name has changed, the address has changed, or if the pin code is incorrect, you can edit. And whenever you edit, the last updated person name and date will be captured then and there. So we also are adding those requirements on the corporation level. We do also inherit the options which are being added at the corporation level. So for this location, if you closely observe, under sites, I have added a corporation which is Abundant Health, and within Abundant Health Corporation, I have one more location. So anything which I have added under Abundant Health will be inherited. So you might have this question, say, what are the things which are being inherited by the corporation? So the blue ones are ones which are inherited, and the gray ones are which are unique to this location. So for example, so what are the things which are not being inherited is the contract documents, but you will also see the contract name, the contract status, what is the start date of the contract, what is the end date of the contract, and if it is open-ended, you will see the end date as it is open-ended. Okay, housing and parking facility is location specific information. You might have to add this information in the start. And we also have HRSA grant, which is will be captured at a location level only, which is not inherited from the corporation. So let's see what is being inherited. The requirements which you added on the site level will be inherited on the location level. For example, we saw COVID booster or the onboarding document or the site checklist, right? But where you say that, site, I want the students to read this document or provide me this document signed off, or they might need to collect this document from site or clinician. They can collect it and they need to upload it, right? In that case, we will request the students or have those options added under student requirement upload, so that the students can see the template or the document which you would like to read them and provide them the sign off. For example, onboarding list, right? Affiliation document which is done with the student and the clinician, or any generic document which the student needs to provide a sign off. Site settings, any practice specialty which you map on the corporation level will be inherited to the location. For example, if I had family medicine on the corporation level, that will show up on the location as well. Site setting notes, any generic notes. For example, whenever a placement needs to be done, we need to reach out to a preceptor, right? If it is added as a note, those notes will be also showing up on location as well. And also you have site level categories. So if you remember, in the initially setup, we have created a couple of categories, like tribal organization or a private clinic or a standalone clinic, right? Those categories will show up on locations. And we also have a couple of documents which just want the students to read, so we can add them under document section. so that we don't want to take any confirmation. So documents which are added at the site level, like kind of a reading material, the student needs to just read through those material. It can be a policy, it can be a tiny guidelines document from the site, right? And the personal details such as practice setting and designation. So contract status, name, start date and end date, which is being also being shown on the location. So what is not inherited here? The actual signed off document, the contract document is not shown on location, and the parking and housing facility. Rest, it is exactly the same as the site. So let's see how do we associate a personal. So if we already added a personal on a site level, then when you're under a location, you will click on associate personal, a draw will show up. If you see that personal in the list, you have to select them by clicking on those checkbox. If everyone is applicable, then it is recommended to click on this first checkbox. But assume a scenario if you encounter a person who is not there on the list and you need to do a placement ASAP, then in that case, we can also allow you to click on this add personal button. A drawer will show up where you can specify the details such as first name, last name, email address, whether the personal needs to be shown in the slot request, whether this personal needs to be marked as preceptor, right? Those options, or the clinician, those options will show up. Once the personal is selected, the next step is to assign them a role, where you can see whether we need to include this person in slot request, whether we need to include this person in email communication. So when you mark this email communication, you will be able to roll out placement notifications to them or any evaluations which needs to be done, so that you can select that option. What is the current designation? Is it a contract administrator or a director or a staff administrator or a clinician like a clinical educator, CI, or a preceptor? Practice setting can be their actual practice setting. And when you click on next, you will see a summary and you will be able to save this information, and the personal will get mapped to that particular location. Next is communication. Any communication where this took place. For example, if it is an one-on-one conversation with the students during that placement, or the student had a challenge with the preceptor and the student needed some guidelines or one-on-one session, you can capture them manually here. So when you click on add communication, the drawer will show where you can capture, such as what was the mode of communication, whether it was done audio, video, in person, or any specific. What was the purpose of communication, title of the communication, what were the points which were discussed, any document which was used during that conversation so that it can be used as a reference material, any follow-up is required. So you can manage those communication and you can extract reports as needed. Next is, so this is how it will show up. When you click on add communication, you will be able to capture all those information like communicated by, subject line, any document which was used, any follow-up is required, any keynotes which needs to be added, you can do that. Next is slots. If you wish to capture availability of a site manually, for example, if you know that the abundant health site location will take at least 5 or 10 students or one student, right? And you wanted to do a placement, you wanted to capture an availability, you can manually add an availability by going to the slots. And when you click on add slots, a drawer will show up where you can select the clinician name, the setting, what is the slot type, status, whether it's confirmed, whether it's tentative, what is the slot type, what is the supervision, and you will see the list of rotations for which it is applicable, the rotation slot start date, end date, and the number of students who will be there on that location. So once you add that number, you will be able to save. But also in order to that, you can also indicate the placement limit. So if you have a placement level limit, you can also mark it as yes and enter the number and save this information. So click on the next. Location placements. Any placements which were done on this location, and if you'd like to know whether this is a good fit, because the more number of the placements, it indicates it's a good location which takes a lot of students from your institute. So on this particular page, you will see the list of students who got placed on this particular location. In order to extract this information, you can use this page wrench and the filter icon. Next is interventions. If a student has any challenges like site guidelines was missing, and on the first date student had a lot of challenges, or the PPE kit was missing, or the student had a challenges with the clinicians, right? All those interventions can be captured at location level as well, so that you can extract a report and check before you go to the site assessments, or before you do the site assessments. This report might come in handy to ensure that you gave a fair feedback to that location, and it can be checked for your future reference as well, like whether it will be a good fit for your students or not. Next is, and when you click on add intervention, the drawer will show up where you can capture the details. The layout is same as the communication. You can extract or add the follow-ups reports. Next is assessments. If you wish to assess a location, for example, if you want to know whether this location will be a good fit for your students, or whether it is being done during a student placement, or whether it is done post the placement is over, this might be one of your options which you can capture. So in order to have the assessments, you will click on add assessments, and at the bottom you will have two options. First one will be the standard exact assessment form. But if you say that Sai, we also manage our own site assessment, we have our institute specific standard form, then I would recommend you to reach out to support team so that they can help you or coordinate with you to ensure that your form is also set under this particular site assessment. Okay, and you can pick and choose. So you can add the basic information like what was the mode of visit, whether it was done in person, whether it was video, audio. You can capture that type of location visit, whether it was ongoing during a placement, or is it a new site, right? Who has done this location? You will see the list of faculties showing up in the list. So date of location visit, when does the location visit happen? And if it is during a placement, we can also tag a student so that during extracting a reports, this might come in handy. So what was the cohort of the student, rotation in which the student is there, and what is the student name, you can tag. So next is location evaluations. So in order to see the location specific evaluations, for example, PT programs have student evaluation of site, right? And if you click on view, you will be able to see the form which is being completed. You'll be able to see all the responses and comments which were provided for that site. Next is HRSA grant. So if the school is interested in capturing HRSA grant information, you will be seeing HRSA grant information on the left hand side, and on the right hand side, when you click on the pencil icon, it is only one box which you will see. When you click on this pencil icon, a drawer will show up where you will be able to answer each and every question in yes and no, and you might also sometime encounter some scores which you would like to enter, and you can extract information as of reports as needed. And also assume a scenario that you have mistakenly added a location, or if you wish to move the location because this location was acquired by some other organization or overarching entity. So there can be two scenarios, right? Either you mistakenly added a location on a wrong corporation or an overarching entity, or this location got acquired by other organization or the overarching entity. In order to move the location, you can click on move location. A drawer will show up where you can select the site and click on next, where you will see the additional information, and there is a graphical representation which allows you to understand, okay, this was the current corporation name and the location which is being moved to the new site, and and this is the location which will be moved. And also you will see the detailed list of the information which is being inherited versus which is being not inherited or moved along with that location. Once you have went through this graphical representation, you have to just click on move location, and you will see a pop-up after a couple of seconds that the location has been moved successfully. And if you go to that new corporation site, you will see under location the location which you have moved. You can also delete the location, but assume a scenario if you have a dependency like a placement was done, or an evaluation was done, or any logs were completed within the system, you will get a pop-up which says slots and placements are available, you cannot delete them. Okay, first it is recommended to reach out to support so that you can remove the dependencies first before you delete the location. So under location, when we added a location, next to that location, you also have location movement history. If you have moved any location and if you'd like to know if it is done by who and when, so when you click on location movement history, a drawer will show up where you can see the location name, moved to which site, moved by the person name, and the timestamp, and whether the location movement was successful or whether it failed. Let's take a question break and see if we have questions in the chat, Jessica.
We do. Could you show us how to pull a report of contracts expiring in 60 days versus 90 days using the filter set?
Sure. Yes. It do we do have that. So I'm just taking a pause on the presentation so that I can show you on the live screen. So when you go to sites, right, you have a tab which says contracts. Click on the tab and you have to click on this tiny funnel icon. A drawer will show up, and if you will have an option which says expiration. So when you select the expiration, you have to select the option like I need a list of sites which are expiring in 30 days. I need the list of sites which are expiring in 60, 90, or whether it's expired, whether it's open-ended. And if you remember, I gave an example. If you'd like to select a particular time period, like a time frame from this date to this date, I need to see how many locations do we have which is going to expire, right? Because we want to pick a location where we are where the contract is not expiring so that we can ensure that our student is secure during that time period. So when I select this option as 30 and if I apply, you will find the list of sites which are going to expire. Okay, so you can see the expiration date in 30 days. So you can see the dates are June 24th, 30th, right?
Yeah.
I hope that
Just as
answers
a
your
note, you
question.
can export that to an Excel too if you need to.
Right.
Cynthia said, perfect, thanks so much. Could you also showcase how do you change the confirmation of this placement from tentative to confirmed, sorry, of the slot from tentative to confirmed once the slot has been created? How do you
Once
update
the
that in slots?
So you can go to slots. You can go to slots under a location. So assume a scenario in this case, for my first row, the slot was marked as tentative, right? So when you click on that slot again, you should be able to make a change on that slot. Currently for this slot, the placement is done. Otherwise it will allow me to change the slot status. But in your case, you should be able to edit that. If the placement is not done, you will be able to update the status. If the placement is done, you will not be able to update it. Does that make sense?
Yes, thank you.
Do we have any?
Another good question.
Yes, please.
Another good question was, um, if if they have a standalone clinic, for example, Smith PT, will it be listed as both the site name and the location, or is it both? Is it one
It
or
is
the other,
marked
or
as
both?
it is marked as site as well as location. So when you're adding a site, right, you will have a tiny checkbox. So let me show you this. So when you're adding a site in the system, if it's a standalone clinic, right, you will add it as a overarching entity or the corporation because you are having a contract with that standalone clinic. And that is the same place where you are sending your students for clinical practice, right? So when you're adding that overarching entity, you have this tiny checkbox which says, do you want to add the site as a location? You have to be 100% sure while you're marking it. If you forgot to mark it as location and you saved it the overarching entity, then you have to manually go into that particular site, then to the location, and then add that standalone clinic manually as a location on that page. Because when you go back to edit that site, you will not see that checkbox that says, do you want to add the site as a location? Okay. And yes, you have to add the same site as location so that you can send your students for clinical practice. Any further questions, Jessica, we have?
Nope, you can continue. And I know we have about 15 minutes.
Awesome. Next is site personnel. So under personal tab, you will see all the list of personals which have been added for that particular overarching entity or the corporation. But on the right hand side, you can also add the list of personnel, like it can be any staff, administrative staff person, it can be clinician, it can be an contract administrator, it can be a contact person at that site. And adding those personnel will come in handy for you while you're adding a slot or while you're adding or mapping those personnel with the site, right? For example, if your contract loses a location, right? For example, if the location is no longer part of that contract, and if you need to initiate a conversation with a person, and when you try to reach out, you might not getting a response. So that at that time, this staff people will come in handy for you to just cross check whether that person still exists there, or you can check with them to initiate a conversation on your contract again. So once the personal is added, right? So when you click on add a person, a draw will show up. You will have mandatory fields such as first name, last name, email address, right? And you can also capture practice setting of that personal degree, designation, any credentials, any NPI you have. And for slot request, the schools like PT, OT, it is recommended to check off include in slot request. And if you're interested in having, email notifications sent for them, for example, for placements, for slot confirmations, or interested for students, you can check off the checkbox. Okay, and you can see you have a question which says, will this person serve as that clinician? You have to mark it as yes or no, and the email address is mandatory. Rest of the information such as primary phone number, phone extension, secondary number, and the address details, right? Those are non-mandatory, but this information might come in handy for you while you're extracting reports. And also additionally, you can capture if the same personnel is also acting as a faculty type or working hours, right? Because sometimes your personnel might reach out to you and constantly say that, you please reach out to me between so and so day. If there is a time difference, and if they want you to reach out on a particular working hour time, then you can also capture that working hours in that particular option. Okay. Next is when you add a personal into the list, you will be able to see their about, like you can capture the basic information which we just added on this page. That is about. If you wish to go back and re-edit that personal's profile, you have to just click on this pencil icon. You can also map this personal with a category. If you remember in the initial setup, we created a category called as open to other programs. If the same personal is also assisting with other programs, you can mark this category. Okay, if the personal is also helping the students with the projects, capstone project or any other projects, and if you wish the personal needs to be marked as particular as project category, you can add that category under setup, and you can mark this personal as project, so that whenever you filter list of person who might help the students on projects or during a clinical placement, you can also use that particular category there. If you have CV, licensures, board certifications which you would like to save, you have to just upload them, and you can also add some notes to the personnel. And also, if you're adding a personal, you can also associate the same personal to a location or location to other sites as well, right? So let's see certifications, let's see association. So when you click on association, a drawer will show up where you can see the list of sites which are being uh, shown up. The grade ones are the ones where the personal is already mapped. And if you see the second step where it says locations from other site, the drawer will show up. And if the personnel is also assisting the student on a different location, or if the personnel is working on a different location altogether on a different corporation, you'll be able to see those locations here. You can apply filter on location name, state, city, and zip code, and you can search that location as well. Once the person has been selected, you have to assign a role where you can select the options such as include in slot request, include in email notification. This is an added advantage on this page. If in a rush, if you forgot to select those options while you're assigning this personal, you can also check this off those checkboxes. You can select the designation and practice setting of that personal. And when you save this information, that personal will get mapped. Finally, you will see the summary and you can just save this information. Next is slots. In order to add slots on a corporation level, and you can see how many slots were offered, how many slots were available, how many slots got occupied where the student got placed, who is the preceptor. You can see that specific information. In order to add the slot, the drawer will show up where you can select the location for which you would like to capture the slot, because this is the added step on the site level in comparison with location. Because in location, we know that the students will be here for a particular rotation and how many students. But when we are adding slots on the corporation level, the first option which you will be selecting is for which location are we trying to capture this availability. If we have the clinician details or the setting, slot status, slot type, or supervision type, we can capture those details, and we can also specify the number of students who might be there. Or if you get an email from a overarching entity stating that for this location we are okay to have 5 students with this clinician, and if you would like to have it added manually, this method will come in handy for you. And you can extract this information in reports. You can use the wrench icon, filter icon, and the page icon to extract this information. Placements. All the placements which took place on this particular site, like irrespective of location, you will see the list of students, student cohort, group, phone number, and if you slide further right, you will be able to see the location in which student got placed, rotation name, course details, everything. You can extract this information as a report. Next is interventions. You can also add interventions on site level as well, on a corporation or the overarching entity level as well. So if you have multiple students going on multiple locations for that particular overarching entity, and if the students are constantly facing challenges, and if you would like to capture those requirements, like if the clinician is taking unnoticed notified leaves or something like that, if the student is not getting a proper guidelines, so all those interventions can be captured here, because during when you extract this information during your site assessment, this information might come in handy for you. So we are having interventions on students level, location, and also on personnel. So for assessments, when you click on add assessments, so we can also do the assessments on the corporation level. And again, in order to get the form added, you have to request a v4 support at exxat.com so that we can create your own custom form within the system. Otherwise, you will see the standard site assessment form on the drawer. The drawer is same as the location. Communication. Any communication which you had with the student for the particular location, or if you wish to see the information across location, this communication button will help you. So in order to capture whether it was done audio, video, or email, or in person, any follow-ups is required, any crucial points which were discussed, or any document which was used for the references during that conversation, you can capture that information. Okay, and communication is also available for students. You can have a communication on the student level, on the location, on personnel as well. Next is slot request. In order to add slots or establish a communication, when you go to sites, you will see a tab which says email, and when you click on set up new communication so that you can request an availability, you will be able to enter the title of the request, whether you would like to request slots or whether you would like to request to update the location information. You have to turn the bits on as per your requirement and then click on next, and you will be able to select the settings for which you would like to request slot type, and you can also select the rotation for which you are capturing the availability. And also, oops, and also you will be able to select the updated information. For example, if you're looking for an information which is only focused on a particular field, for example, whether it has a housing or a parking facility, whether the location has a new personnel, if you want to capture that specific information, you will be able to check them off, and you'll be able to select the rotations. Okay, and click on save. Once the communication is set up, you will see it as a row, the title. You have to click on send emails, select the recipients first, and you can also see the recipients who is going to receive those emails. And when you click on send, save, and next on the right hand side corner, this page will pop up where you have to click on compose email. And once the email has been rolled out, you will be able to see the email dashboard, whether the link was clicked, whether the link got dropped, whether the link was delivered but never opened, right? And if any clinicians or site partners reach out to you, hey, can you please resend me the link? That email dashboard, right? This email dashboard will help you to resend this email once again to the clinical site partners. And this is a sample of how the clinical site partners will receive an email, and they will be clicking on this link. They will not have any username or credentials. This is just a one-time link which they will use to see the list of rotations and the settings and the availabilities which they can provide. So when they click on a link, it will show first them the instructions which are set by you. You can also share a document like a manual with the step-by-step instruction like how to complete this slot request so that you can ensure that the clinician has provided the desired slots for the students. So when they click on start, they will be able to see all the list of rotations, number of students, and they will be able to add the availability. If they wish to contact you later, they will click on this, and if you're unable to accept, they are unable to accept, they will click on this. So if they click on contact later, on the administrative side, you can also set up some notifications which can be triggered at intervals. So once the information is provided, this they will be able to provide the number of students which they will be taking. Oops. And next is response report. Once they have provided the slots, and if you would like to know how many clinicians for which location, which rotation, they have provided you slots, next to email dashboard you will have response report. When you click on it, you will be able to see the total location, how many no responses, how many responses you got, how many slots were offered, how many were marked as contact later, no slots offered, and you can see those information at the bottom as well. You can extract this information as report. You can slice and dice the information using the wrench and the filter icon. And we are also conducting a detailed webinar on slots and slot request. This will be conducted on June 13th from 1 to 2 p.m. Eastern Standard. And you can avail this registration link by visiting Exxat's official page under Connect. Taking a pause here to check if we have any questions till now.
We do not.
Okay. Moving further is reports. So let's take first look on site reports. So under reports, you will have the first report is site details. So when you click on this, this is a comprehensive report. Even you can observe the horizontal bar, right? This is a comprehensive report which will capture all the details of the site so that you can use it for internal reporting purposes, or you can extract this information by editing the columns which you're looking for. So using the wrench and the filter icon allows you to slice and dice, rearrange the columns, even delete the columns by clicking on this trash icon. So deleting the columns will not permanently delete it from the system. If you refresh your page, everything will get back to reset. So this will be a runtime report to extract this information. Okay. So filter icon will allow you to apply filters like on status, state, program, settings, or tags even. So under reports, we also have location specific reports. For example, let's take a quick look on location details. If you'd like to extract a location specific report, you can see the first column is location name, second is label name, third is the associated corporation, the overarching entity name. So this might also help you with the list of locations which are being associated with the corporation as well. Again, you can use the wrench icon to edit them and filter icon to filter them, and the page icon to extract that information in form of reports. And also we have personal specific report, which I will be focusing on two reports today, which is personal detail and comprehensive. So if you closely observe team, we have board certification report, we have licensure report, we have location detail report. So in order to compensate with this multiple reports, team has introduced a new report, which is a comprehensive personal report, which is the bottom fourth one. And I'll be also showing this is recently launched report. So let's go through one by one. So when we go through the personal detail report, you will be able to see their email, associated names, but this report will not show you whether we have board certification, licensures, whether they have uploaded their resume, right? But this is just the basic information which will allow you to extract the personal data. Let's look at the comprehensive report. So when you click on the comprehensive report, you will be able to see how many personals are there, how many were marked as clinicians, how many license was missing, how many missing certifications or expired license. You can also download the report, right? We have dedicated columns. You can see if the document is not there, you will be seeing a missing option. You can download the detailed report, or you can apply filters, or you can move the columns as per your requirement before you extract it. But the detailed report will show all the columns in this comprehensive personal report. Next is site sharing, sharing resources with sites. So you can share a welcome message, an announcement, or course offering, or the rotation dates with them, programs or the courses which are being taught at the program or the institute, or any school point of contact. And how do we navigate is when you log in into your Exxat account, you go to program details, then resource site resources page, and we will click on view site resource. So let's take a quick look. So when you log in, you will click on program details. The page will load. You will have a tab on the setup which says site resources page. You will be able to add a welcome message, an announcement. For example, if you're making a changes in the syllabus, if you're adding a resource material for a clinician, you can add it as an announcement. Clinical education schedules, upcoming clinical education schedules, so that they can quickly check, okay, when they can take a student before they provide you the slots. Resources for clinicians, it can be any syllabus, policies, guidelines, onboarding documents, which is a generic to all the clinicians or the clinical site partners, any clinical education contact from the school. So we can add all those information. And if you would like to see the page, on the very right hand side on orange color, you will see view site resources page. When you click on that button, a page will show up, and you will have this URL. The URL is very unique. In order to share this URL is to copy this and share it manually with your clinical site partners. They cannot Google it and find it out, but the best practice would be, assume a scenario where you're sending a placement notification, right? You can add this link so that for the upcoming rotations or for the upcoming placements, they can check their clinical schedules, resources, or when you're sending a thank you email to the preceptor, you can just add a line stating that please visit our Exxat website. So you can add this link there, so they can see any resources which they might would see, for example, school magazine or a syllabus or the upcoming rotations or school point of contact, right? So let's take a quick look. They can see any announcement which you have said. The clinicians or the sites will be able to see the clinical education schedule, for example, which will look something like this: the clinic course name, course start date and end date, and weeks in duration. And we can have the program wide resources added for clinicians. It can be syllabus, course policies, any attendance policies which the student needs to ensure that when they are visiting the clinical site or location, they ensure that they follow the guidelines. Okay, they will see the list of categories which they will click on it on the right hand side. They can select the particular category as well. Any course specific resources, they will be able to see the syllabus or reading materials or manuals for the clinicians. We can house it here. Any clinical education contact. So they will be able to see their name, designation, and their email address. In some cases, if you have added a message like, please reach out to me between Monday to Wednesday from 3 p.m. Eastern. So you can also add some signature, because your signature covers everything, right? Name, email address, fax, phone number, everything. So I have seen schools who have also added email signatures as well. So again, the best practice would be when you're sending or establishing a communication with the school, you can add this information. Even when you're adding an instruction for the slot request, you can use this link to add it there, so that you can add a manual here, or you can add some guidelines as well, so that they can start using the exact site resources page. Okay. So we also have resources housed on our help center. So under help center, if you go and do a quick search on adding and managing sites, you will be able to access them. And also I have added a quick link to access the manual. And also we have introduced Ask Leo. So when you log in into your Exact account, you can also click on Ask Leo and you can type out a question like, how do I add a location? So this will help you with the step-by-step instruction to add a location within the system. Okay, next series which in the list, I'm taking a pause so that you can take a quick read, and also please do visit our Exact website. Under Connect, you will see those upcoming webinars. Thank you so much for joining this session and taking a pause. Sorry, Jessica, do we have any questions in the chat?
Um, I don't see any question. Actually, oh, there is a question. So when we add the site as a location, like when we click on the checkbox, add site as a location as well, does it show up on the list as two separate entries, or does it duplicate the contact list?
No, it will not duplicate. It will just show. So when you're trying to extract or see the information on locations page, right? So you will
Mhm.
see the location name and the site name as same. It will not have a redundant row or a duplicate row.
Okay. Okay, thank you. That is helpful. Um, I
Just
don't
taking a
see any. Yes, I don't see any other questions being posted right now.
Thank you so much, team. That's all on my end for today's session. Take a moment and please feel free to provide a feedback, a short survey at the end.
Thank you all for joining us and learning about sites and locations module of Exat Prism. Please take a short survey at the end. It helps us improve on our webinars and the trainings that we do for you. Thank you so much all for joining in.